Welcome to another episode of Starting a Private Practice. We have gone over several issues, and this present episode we're going to talk about a little bit more of a detail about practice. We've gone on how to start. We've talked about how to register. We've talked about how to join insurances and so on. But I'm going to talk now about some few nitty gritty part of starting a practice. One of the areas which one has to get into is that you have to get your business cards. Business cards usually will cost about maybe $50 for about 500, or maybe $100 for 1,000. Business cards I would recommend to be simple. Have your name, have your address, have your phone number, have your fax number, and if you have any additional appellation, a DO, an MD, an MP. If with the MP you have an additional doctorate degree, you add it, or you have an additional fellowship, you add it to it. And if you're a specialist and your practice is limited to maybe gastroenterology or rheumatology, then one should add it to that. But the business cards, I would recommend that you have at least 2,000 or more. The business cards can incorporate an appointment in it, so therefore it not only has your card, but it also has at the back an appointment area where you can make appointments for patients when they are seen in the office. These cards are useful because they not only serve to introduce you, they also serve to be able to advertise your practice. So generally speaking, investing in about 2,000 to 4,000 maybe is not too much. But depending on the town and where you are, you should carry a lot of your business cards along with you everywhere and give it out in the hospital, give it out to colleagues, give it out in the churches and so on. And it's an area. Now, talking about advertising, I have mentioned the advertisement before in the past where it's saying that medical practices are not really great places that respond to TV and radio adverts, because of the limitation that is placed by the fact that you have to participate with many insurance plans for you to even be able to see patients. And if you haven't even been able to get on an insurance plan, then there's no point advertising, because even if patients want to see you, they are not able to see you because you don't participate with their plan. However, adverts do bring in people, and once you are already on a plan, on many plans, and you're already well known, then adverts do make a difference. Well, prior before that, at the beginning of starting a practice, advertising on radio, TV, and internet really has a very low yield. What has greater yield is speaking at local areas. So offer to speak at churches, offer to speak at schools, offer to speak in the hospital on topics, and in those areas you are able to create a following because people who know you. Churches may have men's fellowship, women's fellowship in which you offer to be able to speak in. There may be community centers where you're able to speak in, adult community centers, and those areas are better areas in which you'll be able to advertise and actually connect with your local community. And that's one of the major things you should look for in practice. And that way, that becomes a better area for you to advertise. Another thing which I want to mention is the fact that practices are still succeeding. Many people are always looking for saying, oh, we don't really know too many practices that have succeeded or started. But the reality is that people are still starting solo practices. When I started about 2001, and I was among the few who started a new solo practice. But shortly after, which was 20 years ago, about 2 years after, a colleague of mine started his own solo practice. He, as I mentioned before in experiences in medicine, was that one of the reasons I started my practice was because of the experiences my colleague had when they had joined other practice. I remember Dr. Howard Blaustein, Dr. Abbas Ali, and Dr. Nikhil Bhardwaj, who were my classmates when I was a fellow. But while I came to Long Island, I had a colleague, Dr. Saffron, who eventually started his own practice, Long Island Pulmonary, about maybe a year or 2 years. But he had joined a practice which was affiliated with Winthrop at that time. And when he wanted to become partner, I think they had asked for an extraordinary amount, and he started practice, and 18 years later his practice is very successful. And at the time when I started my practice also, there was a young Dr. Lefkowitz who had started his own practice in urology, and he had done very well as a solo practitioner. And I think that while I was starting my practice also, I met a young ER physician, David Kim, who was working as an ER physician, and asked me about starting practice, and he eventually started his own practice. We ended up calling Premier Urgent Care, and which has now joined the CTMD and had become extremely successful. So practices are still succeeding. And in modern day, in the last 2 years, there's a practice in West Hampstead called West Hampstead Medical, who had received advice from me on starting a practice, and they were initially called MLP, and they've already started their practice, and 2 years later now they've broken even and they are successful. So it means that now and always practice will be successful depending on the time you take and the details you add to it. We'll continue this talk again at the next experiences in medicine on how to start a practice. But I've cited examples and I've cited things to do to be able to allow you to practice succeed.